Okay, this is the musculoskeletal prep requirements. Number one, abduction takes limbs blank from the body. Number two, adduction brings limbs blank to the body. Number three, muscles maintain blank, generate blank, and allow for movement. Number four, isotonic muscle contractions blank the limb and decreases the angle. Isometric muscle contractions keep the limb blank without flexion, thus no change in angle occurs. Number six, osteoclasts release blank into the bloodstream. This is called blank. Number seven, osteoblasts blank calcium back into the bone. This reduces serum calcium levels. Number eight, the end of long bones are called blank. This is where blank takes place. In the red marrow, which is stimulated by low oxygen tension, the diaphysis contains fat, which can lead to complications when fractured. Number nine, blank exercises stimulate the bones to rebuild new bone matrix. Number 10, the blank is the largest bone in the body. It is highly vascularized and has the femoral head, and the femoral head connects to the blank, the hip socket. Number 11, deltoid muscle can have up to blank mLs of fluid injected into it. Number 12, injectable fluid greater than 1 ml is given on the blank gluteal muscle. For children, IM injections usually are given on the blank lateralis and blank femoris. Number 13, dorsiflexion points blank towards the face. Plantar flexion points toes blank from the face. And number 14, erythrocyte sedimentation rate assesses for non-specific blank. Now the application part. Blank is the surgical correction of the hip. Number two, blank must be maintained post-hip arthroplasty to prevent dislocation. Number three, blank and blank rotation of the affected leg indicates dislocation of the hip, a common post-op complication we must monitor for. Number four, femur and hip fractures are dangerous because of the high risk for excessive blank and potential blank, an emergent respiratory complication. Number five, blank is contraindicated for post-op hip arthroplasty. Number six, surgical correction of the knee joint is called blank. The post-op goal is to maintain blank and prevent limitations in mobility. A blank machine is provided for the patient post-operatively to maintain movement. Number seven, being on bed rest causes blank stasis, which may lead to blank. Number eight, immobility leads to pressure ulcers and bone blank, which increases serum calcium levels and the likelihood of urolithiasis and blank fractures. Number nine, the head of bed should be no higher than blank degrees for post-hip arthroplasty. Number 10, positive Homan signs indicates possible blank. It is important to elevate extremity and not massage the extremity. Number 11, in blank syndrome, the patient's fingers develop blank, an abnormal sensation. This is caused by repetitive motion of the fine motor movements of the fingers. A positive blank/blank sign will be present, and intervention include immobility of the hand and possible surgery to the median nerve. Number 12, blank dysreflexia occurs when there is an increase in stimulation below the level of injury. This causes a dangerous elevation in blank. The ideal position for the patient includes sitting them in a blank position. Number 13, cast placement on a fractured extremity places the patient at risk for blank syndrome. Assessment of the blank status is imperative to monitor for complications. Rheumatoid arthritis will demonstrate an blank in ESR. In contrast, osteoarthritis is non-inflammatory.